name's Kate Piercy, 373-304. Here's Carmina Entello, 477-968, and then Hannah Maylor, 481147. And we're doing a video demonstration for the new hire in the office. We'll start with donning and duffing. We'll do proper hand hygiene first, and then the first step is the gown. Put it in with the arms. And then okay, and then this bone. And then proper hand hygiene, and then you do your face mask, you hold it by the elastics around the ears and form it to the face. And then it's the eye protection. And then gloves. Making sure it goes over the gown. I would also wear a waterproof apron and utility gloves to sanitize and disinfect instruments, but we don't have them in the kit. To do the duffing, you take off your gloves first without touching the outside, and it's all wrapped up, and you dispose of it in the correct biohazard bin. And then you would do your hand hygiene and tie your gown, and then taking the inside of the gown so you don't touch any of the biohazard parts, and dispose of it correctly. You do hand hygiene, take off your goggles and your mask by the elastics. There we go.
We'll be sanitizing the table and the sink with HID sanitization. I will also be using a detergent HLD, and then we'll also be putting it into the container for the instrument to soak in. I'm going to fill up the sink with cold water. We would use our scalpel, our syringe, and our surgical scissors, and then you put it into the sink for about 10 minutes just to remove all the blood. And then after you clean it with sink it with hot water, you use a disposable brush and you put and then you start brushing and opening your gauze to make sure everything is all clean. And then after you put it in disinfected, you rinse the instruments with hot water until all the soap is all off, and then you put it in a towel. Tap some towel onto it to dry, and then put it in disinfected water. Leave it for 10 minutes, and then after you would put it in another towel and then let it air dry. And then after you'll throw your disposable brush into the biohazard, and also your towel you would also put it in the biohazard. After cleaning all the solution, instruments, you take off your gloves, both your gloves. You dispose this, and then after you would take off your gown. And you also dispose this into the biohazard bin.
Wrapping of sterile instruments. So we have our surgical scissors, our scalpel, and then our forceps. So we will start with the surgical scissors, and you want to make it sure it's fully open, so that ollie can just get sterilized. And then we put a piece of gauze over this so that it does not rip the wrapping. Then we add the scalpel. I don't think we cover the scalpel, do we? No, we don't cover the scalpel with any gauze. And then we add the forceps. And we'll put gauze in between for the forceps. Like this, because it will rip the wrapping. Then we add an indicator strip so that when they open the wrap, they know that it was sterilized, because the indicator strip will change when it is in the autoclave. So then we start by putting corner, and you want to make sure that this folds over, because as you open the wrapping, it should open like a flower. That way the nurse or whoever opens these does not have to touch anything prior to. Like this. And again, making sure all those corners are covered. Making sure that fold is covered. And then we'll add a second piece. Okay, and again we do the same thing where we fold over. And I'm gonna bring them closer. And again we fold over. I'm gonna straighten this out a little bit. Maybe this side. Fold again. Oops, there we go. And then we put this forward. Now there is a little lip here. And so we are going to cover this. So now we're going to tape our sterilization. And we go corner around, making sure that other side has the pull tab. And then we'll do a second piece of tape, fold over again. Oops. Gloves and tape are never fun to do. We're gonna wrap that around so that everything is completely sealed. And then we put what type of sterile equipment this is. So like medical, surgical equipment, we'll say. We put the date, which is the 26th, and our full name. And that is how we do wrapping.